You're here because you want to understand what really matters and, get to the heart of it quickly and thoroughly.
Right.
Forget scrolling endlessly. Today, we're doing a deep dive into something vital: quality in healthcare.
It touches everyone.
Our mission, to really grasp what quality means in this field, moving beyond just buzzwords, giving you knowledge you can actually use.
Exactly. And for this, we're drawing on Dr. Mazen M. Salama's expertise. He's got this amazing background, senior clinical data scientist, quality consultant.
A practicing cardiologist, too.
Yeah, and founder of TQMSC at Atamia. So a really well-rounded view, not just one angle.
Totally. And he's literally taught this stuff, written CPHQ prep courses, guides on quality concepts. We're tapping into some serious knowledge here.
Definitely.
So we'll look at definitions from key players like the Institute of Medicine, CMS. We'll get to grips with big ideas like total quality management, TQM.
And the different sides of quality, the measurable stuff, excellence, how patients see it.
Right. Then we'll break down those critical dimensions from the Joint Commission and unpack value in healthcare.
Which is huge right now.
And we're not stopping there. We'll look at updated TQM principles, how they apply today.
And how all these management bits, quality, utilization, risk, need to kind of mesh together.
Okay, let's dive in. When we talk quality in healthcare, it's so fundamental. Where do we even start defining it properly?
Well, a really solid place to begin is the Institute of Medicine's definition. It's now part of the National Academy of Medicine, of course.
Okay.
Back in 2001, they defined it as the degree to which health services for individuals and populations increase the likelihood of desired health outcomes and are consistent with current professional knowledge.
That's quite packed. What are the key bits in there? Sounds like evidence, competence, communication.
Exactly that. It's about using the best science, having the technical skills, but also cultural awareness, and crucially, communicating clearly.
Makes sense.
And it's not static. Take current professional knowledge. Today, that includes things like AI.
Ah, right. How so?
Well, think about using AI to analyze, say, a cancer patient's genetic markers to predict which treatment might work best for them. That's a huge leap from a one-size-fits-all approach. It's updating how we apply evidence.
That's a really powerful example.
Yeah.
So that current knowledge part is constantly evolving. Okay, what about CMS centers for Medicare and Medicaid services? How's their definition?
CMS puts it more directly, the right care for every person every time.
Simple but strong.
Yeah, what stands out is the focus on the individual, every person, and that reliability every time. Patient-centeredness and consistency right there.
Right care, every person, every time. Very patient-focused. How do they make that happen practically, especially thinking about value?
Well, they have initiatives like MISS, the Merit-Based Incentive Payment System.
Okay.
It's a real-world way they encourage providers to focus on better outcomes, better quality, while also thinking about cost.
Yeah.
It's shifting away from just paying for doing more stuff.
To paying for doing the right stuff well.
Precisely. Rewarding value.
Got it. Now, Dr. Salama also talks a lot about total quality management, TQM. What's the core idea there in healthcare?
TQM isn't just a checklist or a procedure. It's really an organizational philosophy. It's about weaving quality into everything an organization does.
So it's not just one department's job?
Not at all. It has to be pervasive, a commitment from top to bottom. Leadership buy-in is absolutely critical to build that culture.
A whole system approach. How's technology, like all the data we have now, changing TQM?
Oh, it's fascinating. We're seeing data analytics, even machine learning, integrated into TQM.
How does that work?
These tools let organizations crunch huge amounts of data to spot patterns, maybe even predict quality issues before they happen. Like an algorithm might flag patients at higher risk for complications based on their records.
So you can intervene sooner.
Exactly. Moving from reactive to proactive.
That sounds incredibly useful. Okay, another key idea from Dr. Salama. Doing the right things right. Seems simple, but what's the deeper meaning here?
It basically boils down to two parts. First, doing the right things. That's using evidence-based practices, the stuff experts agree works best.
Okay, based on research.
Right. And second, doing them right. That's delivering that care in a way that fits the individual patient's needs and, importantly, their preferences.
So it's the science plus the personalization.
You got it.
Yeah.
Balancing best practices with what matters to the patient.
How do we figure out what matters to the patient, though? How do we measure that?
That's where things like PROMs come in, patient-reported outcome measures.
PROMs.
Like these are tools, maybe questionnaires or apps, where patients directly tell us about their health, their experience, the outcomes they care about. It goes beyond just were you satisfied?
Ah, so it gets at their actual health status from their perspective.
Exactly. It gives really valuable insights for tailoring care and even making bigger policy changes.
Okay, so quality isn't just one single thing. Dr. Salama mentions measurable, appreciative, and perceptive quality. Let's take measurable first. What's that?
Measurable quality is pretty much what it sounds like. It's about sticking to defined standards, clinical guidelines, regulations, that sort of thing. Stuff we can track with numbers.
Like what kind of numbers?
Think about metrics like blood sugar control rates for diabetics, hospital readmission rates, infection rates, things you can count and measure.
The hard data. How has tech helped with tracking this?
Electronic health records, EHRs, have been huge. They allow for collecting and analyzing clinical data almost in real time.
So you can spot problems faster.
Much faster. If a metric dips, you can see it and react way quicker than shuffling through paper charts.
Makes total sense. Okay, next is appreciative quality. Sounds more subjective, like recognizing excellence.
It is, in a way. Appreciative quality is about going beyond the minimum standards. It's
Yeah.
excellence that's recognized, often by peers.
Like doctors reviewing other doctors' work.
Exactly. Peer reviews are a big part of it. It even comes up in legal contexts sometimes, determining if care was reasonable. It's also seen in adopting innovative stuff like robotic surgery or new techniques.
So pushing the boundaries, exceeding the basics. And the third one, perceptive quality. This must be the patient's view.
Totally. Perceptive quality is all about how patients and even the public see and experience healthcare. It's driven by things like satisfaction, communication, empathy, trust in the doctors and the hospital.
The whole experience factor.
Precisely.
How do we measure that? Seems harder than infection rates.
We use standardized surveys. You probably heard of HCA-HPS, the Hospital Consumer Assessment of Healthcare Providers and Systems.
Ah, yeah, those surveys you get after a hospital stay.
Exactly. They systematically collect patient feedback on their experience, giving organizations data on what patients perceive and where they can improve that perceptive quality.
Okay, this is building a really rich picture. Now, let's shift to the key dimensions of quality care from the Joint Commission. There are several. Let's tackle them. First, appropriateness.
Right. Appropriateness means the care fits the patient's clinical needs and, crucially, is based on the best available evidence.
So like using the right antibiotic for a specific type of pneumonia based on guidelines.
Perfect example. It's about matching the treatment to the diagnosis, using established best practices.
And how's technology refining appropriateness now?
AI diagnostic tools are becoming more common. They can analyze imaging, labs, lots of data to help doctors make more accurate diagnoses and choose the most appropriate treatment for that specific patient.
Okay. Next dimension, availability. Seems obvious, can people get the care they need?
That's the core of it. Overcoming barriers, money, distance, culture, whatever, stops someone getting care.
Like telehealth, helping people in rural areas see specialists.
Exactly. Telehealth is a prime example of boosting availability.
What else is helping now, beyond just video calls?
Well, mobile health apps, virtual care platforms in general. Patients can often book appointments, get monitoring, even refills via their phone. Makes care much more accessible for many.
Dimension 3, competency. This is about the skills of the people providing care, right?
Yeah, precisely. Do the doctors, nurses, technicians have the right qualifications, skills, ongoing training?
How do we ensure that?
Things like using surgical checklists are a good example. A standard process to make sure a competent team follows all the key steps, reducing errors.
And for keeping skills sharp. With medicine changing so fast.
Simulation training is increasingly important. Practicing complex procedures or emergencies in a safe, simulated environment helps build and maintain competency without patient risk.
Moving on to continuity. Ensuring care is smooth across different doctors and over time.
You nailed it. Especially vital for people with chronic conditions seeing multiple specialists.
How do you achieve that?
Integrated care plans are key, making sure everyone involved with the patient is communicating and working towards shared goals.
And technology's role here.
Interoperable EHRs are massive. When different systems can actually talk to each other and share patient info securely,
Everyone has the full picture.
exactly, it dramatically improves continuity.
Okay, halfway point. Next, effectiveness. Does the care actually achieve the desired results?
This is kind of the bottom line, isn't it? Using treatments that are proven to work. Like
Right.
protocols for managing sepsis quickly, they've been shown to save lives. That's effectiveness.
And how are we pushing for more effectiveness?
Precision medicine is a big part of it now. Tailoring treatments based on individual genetics, lifestyle, makes the care much more targeted and hopefully more effective.
Next up, efficiency. Getting the most bang for the buck, basically, using resources wisely.
Pretty much. Maximizing outcomes relative to the resources used, time, money, staff.
Hmm.
Like streamlining workflows in the emergency department to cut wait times without sacrificing care quality.
What helps improve efficiency now?
Things like lean management principles, cutting waste,
Mhm.
optimizing processes, also automation for certain tasks, both admin and sometimes clinical stuff too.
Okay, dimension 7, prevention early detection. Stopping problems before they start or catching them early.
That's the idea. Think vaccinations, cancer screenings, classic examples of preventing disease or finding it when it's most treatable.
Are there newer ways we're doing this?
Wearable devices are interesting here. Continuous monitoring of vitals, activity, might pick up early warning signs of problems before someone even feels sick.
Number 8, efficacy. Now, this sounds like effectiveness, but is it different?
Subtle difference, yeah. The Joint Commission uses efficacy here to mean sensitivity to the patient's needs, values, preferences, and getting them involved.
Ah, so it's about patient involvement.
Right. Shared decision-making is key. The patient and doctor discussing options together, making choices that align with what matters to the patient.
How are we supporting that more?
Patient decision aids are being built right into EHRs sometimes. Tools that give patients clear info on options, risks, benefits, so they can have better talks with their doctor.
Empowering the patient. Okay, almost done. Number 9, safety. Hugely important.
Absolutely paramount. Minimizing the risk of harm. Medication reconciliation is a great example, carefully checking a patient's med list at every transition to avoid errors.
And technology's role in safety.
AI is playing a role here too. Systems that might predict patients at high risk for falls or flag potentially bad drug interactions before they happen.
Proactive safety nets. And the last dimension, timeliness. Getting care when it's needed most.
Crucial, especially in emergencies. Think rapid response teams and hospitals getting expert help to a deteriorating patient quickly.
And tech helping with timeliness.
Predictive analytics again. Identifying patients at higher risk for urgent events like strokes or heart attacks, allowing teams to monitor them more closely and intervene faster if needed.
Wow, okay. That's a really comprehensive set of dimensions for quality. Let's switch gears slightly to value. We hear that word constantly. What's the basic formula for value in healthcare?
The core idea, based on Dr. Salama's work and others, is often expressed as value equals quality plus outcome divided by cost.
Quality plus outcome over cost.
Right. It emphasizes that you need good quality care and good patient outcomes, considered in relation to how much it all costs. It's about optimizing that balance.
So it's not just about being cheap.
Definitely not. It's about getting the best possible health results efficiently.
You mentioned the shift to value-based care earlier. How does that look in practice, like ACOs?
Exactly. Accountable care organizations, ACOs, are a good example. Groups of providers work together, taking responsibility for the overall health and cost for a population of patients. They're incentivized to keep people healthy, manage chronic disease as well, avoid unnecessary hospital stays.
Focus on prevention and coordination.
Precisely. Driving value.
What does a value-based system mean for patients? What might they notice?
Hopefully more coordination, but also increased transparency is a big goal.
Transparency about what?
About quality performance, how different doctors or hospitals rate, and also about costs, making that info public. Plus, tools like cost estimators to help patients make more informed choices.
Giving patients more information, more agency, any new tech helping with transparency.
There's exploration into things like blockchain. The idea is it could create secure, verifiable records of care and costs, potentially making things even more transparent down the line.
Interesting. Okay, let's loop back to TQM, total quality management. Dr. Salama highlights core principles. How are these classic ideas holding up or changing today?
They're surprisingly relevant, just applied with new tools. Take processes drive work.
Okay.
Today we have process mining software that can digitally map out how work actually flows, pinpointing inefficiencies or bottlenecks in ways we couldn't before.
Very data-driven process improvement. What about customer-supplier relationships? Who are the customers and suppliers in healthcare, and how's that changing?
Well, the primary customer is the patient, obviously, but also payers, referring docs, the community. Suppliers are everyone involved in care.
Right.
We're seeing CRM systems, customer relationship management, being adapted for healthcare to better manage interactions with all these groups, improve communication, build trust.
Using tools from other industries. Okay, another principle. Process problems cause defects. How are we finding those root causes better now?
Traditional root cause analysis is still key, but AI is adding power. AI can sift through massive data sets to find subtle patterns or contributing factors to errors that a human might miss, getting closer to the real underlying issues.
And the idea that poor quality is costly, how's that being shown more clearly?
Organizations are getting much better at actually calculating the cost of quality, or rather, the cost of poor quality.
Putting a dollar figure on errors and waste.
Exactly. Quantifying the financial hit from things like infections, readmissions, inefficiencies. It makes a stronger business case for investing in quality improvement.
TQM also talks about understanding variability. What does that mean in healthcare?
It means recognizing that processes naturally vary, but too much uncontrolled variation leads to inconsistent quality. Think different doctors doing the same procedure slightly differently every time.
How do you manage that?
Statistical Process Control, or SPC, helps monitor processes. Now, it often uses real-time data from EHRs to track variation and signal when a process is going off track.
Okay. And focus on vital processes. How do you know which ones are vital?
With so many processes in healthcare, you can't fix everything at once. Predictive analytics helps identify which processes have the biggest impact on outcomes, safety, or cost. Focus efforts there for the biggest bang for your buck.
Makes sense. Then there's the scientific approach.
Right, using data and evidence. The Plan, Do, Study Act, PDSA cycle, is still fundamental for improvement projects.
But now fueled by better data.
Often, yes. Real-time data allows for faster PDSA cycles. Test an idea, see the data, adjust, test again, much more rapidly.
TQM emphasizes employee involvement too. How are staff being brought into quality efforts?
Beyond suggestion boxes, organizations are using things like internal crowdsourcing platforms or focused team meetings to get ideas directly from frontline staff.
Tapping into their direct experience.
Exactly. They often know best where the problems and potential solutions lie. Empowering them is key.
And organizational structure, how does that fit with TQM?
We're seeing more cross-functional teams, bringing people from nursing, pharmacy, IT, admin, etc., together to tackle a specific quality problem. Breaks down silos.
A more integrated approach. Lastly, the Duran trilogy: planning, control, improvement. How's that managed now?
Digital dashboards are huge here. They give leaders real-time visibility into key metrics across planning, setting goals, control, monitoring performance, and improvement, tracking projects. Makes it easier to manage the whole cycle.
So these TQM principles are definitely alive and kicking, just getting a modern tech boost.
Absolutely. Still incredibly relevant, just evolving with the times.
Okay, final big piece. Integrating all those different management functions. Why is it so crucial for quality management, utilization management, risk management, and others to work together?
Because healthcare is too complex for silos. These functions are all intertwined. Poor quality can increase risk. Inefficient utilization drives up costs. You need a coordinated strategy for optimal results.
They all impact each other.
Deeply. Effective integration means better resource use, safer care, better outcomes, more value. It's about a holistic view.
Let's touch on a few key functions and how they're evolving. Quality management itself.
Core function, measuring and improving care. As we said, AI analytics are now helping predict outcomes, allowing more proactive quality efforts.
Utilization management, or UM, ensuring resources are used right.
Exactly. Right care, right place, right duration. Machine learning is helping optimize resource allocation, finding waste without hurting quality.
Risk management, identifying and mitigating dangers.
Yep, preventing harm, reducing liability. Predictive models are getting better at spotting high-risk patients or situations before something bad happens.
Infection control, obviously vital.
Critically important. Preventing infections. Newer tools like genomic surveillance help track how bugs are spreading, allowing much more targeted interventions.
Case management and discharge planning, coordinating the patient journey.
Right. Making sure care is coordinated during the stay and transitions are smooth afterwards. Telehealth follow-ups are becoming common to support patients after discharge, reduce readmissions.
Practitioner credentialing, verifying qualifications.
Essential for safety, making sure providers are qualified. There's exploration of blockchain here, too, for potentially more secure and efficient credential verification.
And continuing education, keeping everyone up to date.
Lifelong learning is non-negotiable in healthcare. We're seeing innovative methods like VR training for realistic, engaging continuing ed.
So the key to making all this integration work sounds like data and communication.
Absolutely. Data integration is number one, pulling info from QM, EM, RM, IC, clinical systems all together, and then timely communication based on that shared data.
Are there systems that help do that?
Yes. Integrated care platforms like Epic's Cosmos is an example people might know, aim to provide that central hub for data sharing and coordination across different functions.
This has been incredibly insightful, really digging into what quality means in healthcare, thanks to Dr. Salama's framework. We've covered a lot of ground.
We really have. From basic definitions to AI applications, TQM, value, integrating everything, it shows quality is, well, complex.
Dynamic, constantly evolving.
Definitely. It's this ongoing pursuit of excellence across so many dimensions: evidence, patient needs, efficiency, safety. Always safety.
And understanding these pieces, the definitions, TQM, the dimensions, integration, it feels essential for anyone involved in healthcare, really.
It truly is. Whether you work in the field or studying for something like the CPHQ, or you're just trying to be an informed patient or caregiver, knowing this landscape is invaluable.
So as we wrap up, here's something for you, the listener, to think about. With technology like AI advancing so fast and this big push towards value-based care, how do you think our definition and measurement of healthcare quality might change even more in the next few years?
Yeah, what could that mean for the care you or your family receive? And for the whole system?
It's a fascinating question to keep in mind. Thanks for joining us on this deep dive.